Welcome to today's session titled Aging Policy and the Biden Administration, Opportunities for Philanthropy and Advocates. Before we get started, I would like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce Lindsay Goldman, CEO of Grantmakers In Aging, and the moderator for today's webinar. Lindsay?
Welcome, and thank you so much for joining us today. I'm Lindsay Goldman, the new CEO of Grantmakers In Aging. Grantmakers In Aging is a national membership organization of philanthropies that acts as a relevant and responsive network, resource, and champion, amplifying the voices of older people and issues of aging. Our vision is a just and inclusive world where older people are fully valued, recognized, and engaged in ways that matter. We want to thank the National Council on Aging for presenting this webinar with us today. The National Council on Aging, NCOA, serves as the national voice for every person's right to age well. NCOA believes that how we age should not be determined by gender, color, sexuality, income, or zip code. Working with thousands of national and local partners, NCOA provides resources, tools, best practices, and advocacy to ensure every person can age with health and financial security. Founded in 1950, they are the oldest national organization focused on older adults. We also want to thank the John A. Hartford Foundation for their support of today's webinar. So moving into the program. A new administration and Congress presents opportunities to influence public policy to improve the health and well-being of current and future older adults. We are so pleased to convene this expert panel of GIA members to discuss the top aging priorities for the new administration and the role philanthropy can play in helping to move the needle on the most pressing issues of aging in America. Kristen Kiefer, Chief Administrative Officer of the National Council on Aging, will provide introductory remarks and then facilitate a conversation between her colleague Howard Bedlin, the Vice President of Public Policy and Advocacy of the National Council on Aging, and Tim Lash, the Chief Strategy Officer and Executive Vice President of West Health and President of the West Health Policy Center. Welcome, Kristen, Howard, and Tim. Howard is having some video issues, so we will hear from Howard, but we do not expect to see him during the program. Following their discussion, the panelists will field questions from the audience, so please submit your questions at any time during the program. And I'll just ask the panel to please refrain from using acronyms because our webinar participants have varying levels of knowledge about policy. And I will also note that we will be making the slides and the audio available after the program. And now I will turn it over to Kristen Kiefer.
Thank you, Lindsay, and thank you so much for the Grantmakers In Aging and all of the members and the continued partnership and the good work you all do. And thank you for allowing us to be a part of this conversation today. As you've said, the COVID-19 pandemic has clearly laid bare the disparities in life expectancy, chronic illness, wealth, and health among diverse older adults. And many of all of our partners, from area agencies on aging to senior centers to community-based organizations, have really seen and been on the front lines of the crisis that we've all experienced over this last year plus. So education, awareness, and navigating the difficulties of service delivery and policy advocacy during the last year or more has been challenging. But it is time to continue to learn from and honor all of our partners, community-based and national, that have paved the way for increased access to services and hope while transforming the aging network along the way. Our hope today is that this discussion provides key insights into what is going on at the federal level, but we also hope to stimulate thoughts across all of us in terms of what a tri-sector collective call to action can and should look like, and how we co-create a pathway to aging well and equitable aging for all as a matter of social justice and community healing. Underlying, and if we could go to the next slide, I'll just tee this up just a little bit. So underlying President Biden's agenda for older adults is definitely the issue of equity. It's an issue we're all talking about and care deeply about. COVID has shown light on the systemic barriers that further have exacerbated the inequities. President Biden's priority areas listed here really speak to the need to change some outdated policies, while also stirring up a groundswell movement, starting in communities so that all boats can rise together and continue to address these inequities. Now I'd like to turn to sort of just setting some groundwork in the landscape and the many moving parts on the federal level, and we'll now start a fireside chat with Tim and Howard. So Howard, I'm going to start with the first question for you, and we can go to the next slide, because I know you'll be speaking to this, both you and Tim. So I'll start with Howard. Can you walk us through some of the Biden administration's initial top aging priorities and where we are to date?
Sure. Thanks, Kristen. And I apologize for my invisibility today. I am here live in person. We've got a lot to go on from the administration. 4 different sets of proposals that have come out. The first was during the campaign. It was Build Back Better platform, which had a wide variety of significant proposals that would help older Americans, aspirational and bold. Then in March, the American Rescue Plan was enacted into law. It was largely in response to COVID-19 pandemic. With regard to older adults, significantly, it included an increase in the Medicaid match for home and community-based services. We'll get into that more later because there was another proposal that's still pending, but that was only for 1 year. It was a 10% increase in how much money the federal government gives to states for home and community-based services. There was also a really significant investment in Older Americans Act programs, over $1.4 billion, including dollars for vaccine outreach and education. Problem with a lot of the provisions of the American Rescue Plan is that they expire, most of them after 1 or 2 years. So we have significant cliffs that we have to deal with going forward. Now, we also have 2 very significant proposals that have been outlined in relative detail, but now it's going to turn to Congress. The American Jobs Plan and the American Families Plan, each of which has significant provisions for older adults. The big one in the American Jobs Plan is $400 billion, a lot of money for Medicaid home and community-based services. It's an area that aging and disability and labor groups have come together around for a number of years, and we see this as a potentially historic opportunity. Folks may know that under Medicaid, nursing facility services are mandatory. For home and community-based services, they're optional. I would argue that care at home is safer, less expensive, certainly strongly preferred by families. The challenge going forward this year is not only to keep it in the package, but also how to balance the need to improve access to services with the workforce improvements that are clearly needed. Folks may have heard that there's over 800,000 person waiting list for Medicaid home and community-based services, but not all states collect those waiting list data. And in fact, many experts believe it's closer to 1.5 million people on waiting lists. And with regard to the workforce, home care aides really are struggling. Their average wages are about $12,000, oftentimes with no benefits, no career ladder. And the demand for these services, given our demographics, is going to increase significantly. In addition, the American Jobs Plan invests about $100 billion in workforce development programs, largely targeted at underserved groups. And while there isn't specific language on older workers, we and others are advocating to include some provisions for older adults. Our CEO, Ramsey Owen, folks may have heard, testified before the Senate Aging Committee and had a lot of recommendations for improving services for older workers, including funding for the Senior Community Service Employment Program, which is the only federal program targeting older workers, investing in different evidence-based approaches, and looking at age discrimination. And there is legislation pending that would aid some of the age discrimination in hiring practices. The third thing quickly is investing $100 billion in universal access to high-speed broadband, which is clearly an issue for a lot of people of color who are older adults and a lot of older adults in general who either don't have access or are uncomfortable using their computer. And finally, there's some housing provisions that we hope will address housing for older adults and as well as transportation. So that's the American Jobs Plan, and it's chock full of things. I hit on some of the highlights. The American Families Plan, most significantly in terms of the details, included a family medical leave proposal. Generally, the federal government has only required leave for maternal care, but this would expand up to 12 weeks of paid leave for parental and family care by the end of the 10-year phase-in. And this would provide workers up to $4,000 a month with a minimum of about 2/3 of their annual average weekly wages replaced. Secondly, and there's been a big debate about this that's continuing because President Biden did not explicitly include recommendations on Medicare improvements, but he did mention them in his speech, particularly with regard to prescription drug costs and lowering prices. He also mentioned in his speech that some of those savings could be used for Medicare improvements, and we and other organizations representing Medicare beneficiaries are hopeful that this year we'll see improvements that we've been working on for decades. We're looking at a bill that passed in 2019 under H.R. 3 that not only included robust prescription drug improvements in terms of lowering out-of-pocket costs, but also had savings, which we can talk more about with regard to having the Secretary negotiate prices, including penalties if costs increase above a certain inflation amount. But in addition, H.R. 3 included other improvements on dental, vision, and hearing, significant investments, $238 billion for dental, $30 billion for vision, $89 billion for hearing, as well as improvements in low-income protections, which is a high priority for NCOA, $105 billion. You know, the challenge is going to be, are all these going to have to be paid for with other savings? Can we, find a way to improve Medicare without necessarily having every penny paid for? The last piece that I want to mention is other health care improvements with regard to the Affordable Care Act. The American Rescue Plan did provide for additional ACA premium subsidies for 2 years, which really would help pre-Medicare populations a great deal in terms of affordability. The American Families Plan would make those permanent, and also Medicaid expansion. Not all states have adopted it, and we're hoping that those kinds of incentives for additional states to take up the Medicaid expansion can be made permanent. So it's a long list, but those are some of the highlights that we're focused on this year, and we'll see how they all play out.
Thank you, Howard. It's exciting that there's so much going on. I just also know how hard it is to kind of keep up on it. Tim, I know you also have some additional thoughts, I'm sure, on what Howard's already built for us, but I also want to throw another question your way. Given with all of this in mind, in terms of what Howard just laid out and some other thoughts you may have, where do you see the greatest opportunities this year to advance the aging community's priorities?
Sure, great question, Kristen. And Howard certainly, put a fair amount on the table to unpack, which could be challenging given Lindsay's guidance to not use any acronyms to hide behind. But I thought, just as we think about, where there might be opportunities moving forward this year, and I think this framework will be helpful, for the, attendees of this webinar, even looking towards the future, is to think it in the context of why are we even talking about policy in the first place, and then what is policy? Because there's, I think we can get confused in terms of legislation, regulation, et cetera. So, when I just make it stupid simple in my mind's eye, right? Policy is like bumper bowling. I remember going, with my kids, we go to the bowling alley and they put these bumpers up, and it dictates how the ball goes down the lane, right? And when we think about policy and policy in the aging space, it really defines the bumpers, whether that's the availability of funding, right, to, or increased funding to further support, programs that are underway, or changing the rules, or more importantly, the incentives, right, that cause some, organizations to do one thing versus another to drive, sort of the market in the area that we want to go. So as I think about sort of the policies that are on the table now, and when we talk about the policies that might be, possible in the future, it is important to differentiate. Are we simply just putting more dollars on top of existing systems and infrastructure that exist, which in some cases is the smart thing to do, but it's in other areas of our aging space, it's like we need a three-legged stool, but we have a two-legged stool and we're just putting more weight on top of it. So we might need to think about more structural changes or policy that incentivize different behavior than what we're seeing today, not just more dollars. And then, it's, the other is, do you change the bumpers to say, no, we don't need more dollars here, we just need to be incentivizing different outcomes, and I think examples of that are, moving from fee-for-service to more value-based care, specifically in the Medicare population. So that's just a construct as we move forward, right? Do we need more dollars and policy there, or do we need to actually sort of change the structure and the behavior? And then on the sort of the policy itself, legislation, right, for the group are things that have to sort of pass through Congress, and there's a lot on the table now that President Biden articulated as part of the campaign as aspirational. I think we're quickly moving now to things that are possible, that I think Howard did a very good job outlining. And then, by the midsummer to the fall, we'll finally get to what is probable from a legislation standpoint. And there, I think, you're likely gonna see the most probable things, tied more to sort of, just pure additional dollar investment. It'll depend on how many dollars, are ultimately available. And then those things that are, more closely tied to equity disparities that exist in the marketplace, and or sort of COVID relief, and obviously those two concepts are inextricably linked. But beyond legislation, there's the sort of administrative priorities, which are the regulations. So what can CMS do itself, or or the innovation group, specifically within Medicare, and there I think there are a fair number of opportunities on the table, as they relate to telehealth, which specifically is a very important space as we look at sort of aging policy and aging access to services. We think about sort of telemodalities as sort of healthcare interventions. As part of my role, I run a PACE Center, a program for all-inclusive care for the elderly in North County, really comprehensive model to meet, sort of the needs of very, frail seniors that would otherwise be in nursing homes. And we deployed sort of, telehealth, right, very early on in the pandemic. And what we found was that the number one use was addressing social isolation. It wasn't, sort of medical consults or specialty consults, or anything on that sophisticated bleeding edge. It really was, just the opportunity to regularly engage, and telehealth and the ability to project care, even social engagement into the community, is sort of top of mind, and for CMS, and very much linked to the I'm just looking on the slide here, the fourth bullet, right, as it relates to high-speed internet, because if you don't have that infrastructure, obviously you can't reach out. So I guess I could go back to Howard on this, just to have sort of a little bit of sort of dialogue. Howard, how do you think about sort of on the legislative side, are we going to see more funding or more truly structural reform, and are there some additional things on the regulatory side that this group should be thinking about?
Yeah, good questions. Right now we're really getting into the politics of all this in terms of what could happen, and I have to think about the processes that the Senate has to go through with regard to what's referred to as the reconciliation process, which is a way that the Senate can overcome filibusters and pass legislation with only 50 votes. When we saw how the American Rescue Plan passed, it was with Democratic-only votes. So a lot of what they're looking at are things that may not get any Republican support. You know, you may have heard recently that Minority Leader McConnell was quoted as saying that he's 100% focused on stopping President Biden's agenda. We're not in a climate where there's a lot of bipartisan support. So the question is, with the margin so close, a 50-50 Senate, Democrats only able to lose, I think, 3 or 4 votes and get something through. What can happen when the margins are that close? And every Democrat has leverage to hold off and try to get what they want. As a result, circling back to your question, I don't see, major structural changes. A lot of these are, adding benefits where there are gaps in Medicare coverage or expanding access to things that are currently available. And I think, we have a lot of work to do. My sense is that these are building blocks towards larger reforms. One example that I didn't mention is changing the Medicare eligibility age, which is a complex issue. Senator Manchin has said he doesn't support it, so it may not go anywhere, but that's the beginning of, structural reforms that some progressives want in terms of Medicare for all. The other thing is that we also need to look at is the federal budget. We understand that the detailed budget is going to come out sometime the week of the 24th. We think that's a real opportunity to try to extend some of the things that are expiring. And right now, a lot of this is in the Congress's hands. The president is negotiating over infrastructure issues with a group of moderates to see if they can pass something on a bipartisan basis and get 10 votes, which is going to be difficult. But there are a number of things that I just want to quickly mention that I think the Congress wants to take the lead on. For example, in the caregiver space, they're looking at a tax credit for caregivers that will be introduced soon, which was part of the Build Better plan, but not in any of the more recent proposals. They're looking at nursing home quality. I agree there are opportunities in telehealth, both at the regulatory and legislative levels. And, I was particularly pleased that there is some bipartisan agreement. For example, the Ways and Means Committee, which has jurisdiction over taxes and Social Security and Medicare, passed a bipartisan bill called Securing a Strong Retirement Act that expands automatic enrollment, simplifies retirement plan rules, and strengthens small businesses' ability to offer workplace retirement plans. So there are opportunities for bipartisan cooperation, but, it's going through the sausage process right now. And we do get a lot of questions about what can be done without legislation, because there's a recognition this is going to be a heavy lift. Pharmaceutical companies are going to, strongly oppose some of the prescription drug proposals. We're seeing that a lot of corporations are opposing some of the revenue raisers with, tax increases on wealthy individuals and corporations. So it's going to be a slog, and I think it's very wise for us to be thinking about areas where there are bipartisan agreement and areas where we can do things through the administration and regulatory arenas.
Howard, I just want to, and Kristen, before we go back to you, I just want to pick up on one, thing Howard, said, which I love the terminology. It's going to be a slog. I couldn't agree more. I think for the group, one thing just to emphasize is it's really easy to be, I think, falsely encouraged by, some of the promises that are put forward, in the campaign or very early on in some of the proposals, that the administration sort of might release as it relates to sort of aging policy. But then as that slog actually plays out, it just sort of, further amplifies the role of, and we'll talk about this, but the role of philanthropy and other groups to keep the pressure on, because we lose steam and we lose the willingness to be bold. So, Howard, talked about HR3, a very, impactful, piece of policy that passed through the House that could save billions of dollars and, millions of lives, over, the decades to come. That had, support from the administration. It had support from the Congress. And as you sort of, move forward, you see, less and less willingness to be bold. And I think where we sit right now in DC is sort of a tale of two cities, where you had, a very aggressive administration in the beginning. You had a very aggressive Congress, and you had a Senate, right, as Howard had pointed out, that that is sort of razor thin in the ability to get something done, and a more just conservative bent. And as we, continue moving forward, on these policies, we have to keep the pressure on, because, the Senate was already conservative, and the administration and the House are becoming more conservative. And, to put just a final point on that, this concept of Medicare negotiating that Howard spoke of, literally could save over $400 billion a year, not just for Medicare, but, broader, savings, for the commercial markets as well, save over 120,000 lives. And it was being debated whether the president would even mention that potential sort of policy move the morning of his speech, because there's just this fear of going against big pharma. And specifically for President Biden, it's very personal, right? He buried a son to cancer, and you have oncology is one of the sort of bleeding edges and more promising areas of the pharmaceutical sector. So you have all of these dynamics that influence just how bold people are going to be. And I think we all have a position, to be aware of what's possible, and then continue to sort of, push folks so that we don't, that what's probable is as aspirational as bold as possible.
Yeah, thanks,
just a
Tim.
couple
And
more.
how,
I was just going to make a couple very quick points following up. Further complicating all this are concerns about the deficit and the debt. We're talking about 3 bills that each cost about $1 trillion, and that's where the pressure comes to find offsets, and recent concerns about inflation. So it's a difficult political environment, but in part to your point, education about the need for these proposals, about how they work, these are complicated. Talking about negotiations on prescription drugs, trying to educate people on the need for low-income protections, which would, really help people of color who are older adults and tend to be lower income and have lower savings. A lot of members don't understand these programs. A lot of them don't know the difference between Medicare and Medicaid, or don't know about the Older Americans Act. So help in trying to do that kind of education is particularly important, and philanthropies can help a great deal in that regard.
Absolutely. You both brought so many insights up. Tim, one of the things that resonates specifically, which I sort of started the session on, is the importance of the intersectionality of service delivery and the informing of public policy as a result of that. You mentioned the PACE program that you all run, but the insights that come from community and the education that the community-based organizations just have right on the ground really informs and should inform policy and advocacy. And to your point, continue to bring that bold steam ahead to force the issues more at the federal level. So appreciate that insight. And I think the other insight too is the learning from community. How do we galvanize around that on the issues of specific importance at this time? So with that, we could go to the next slide really quickly. I want to try to be mindful of getting into kind of let's take this to a practical level. I think you've covered a lot of these, but Howard and Tim, both of you, maybe in a one minute round, rapid fire, any additional thoughts on future, meaning we're kind of in the slog thing right now in terms of this year and everything that's coming at us in the moment. For the next year or the longer term, we put some things up here on the screen in terms of future opportunities. 1 minute for each of you. What are the key opportunities from your standpoint? So I'll start off with Tim.
Sure. So, to Howard's point on the role of philanthropy to educate. So I'll just, start on this prescription drug. So, a couple things. One, high cost of prescription drugs cost lives, right? We've done some modeling that suggests 120,000 Medicare beneficiaries die every year because they can't afford their drugs, period, right? So it's not just expensive, it's costing lives. And if there's one thing that we can get out there, right, as a group, it's one that we can, have people understand that, and also have them understand it doesn't have to be so, right? Pharma potentially had a halo effect, right, of, with these vaccines, but it didn't materialize. The reality is you could strip $1 trillion, right, of sales out of the pharma sector, maintain the same level of R&D, the mergers, research and development, mergers and acquisitions, all of the things that fuel the innovation, and it would still be the most profitable sector of our economy. So we can have our cake and eat it too. We can have, wonderfully innovative drugs that save lives, and we can stop costing lives because they're so expensive. And I pray that we get something done on drug reform this year. But if we don't, I think, just for the population that we care about, this is, a tremendous opportunity. And then with the last 10 seconds, I'd say value-based care. We've seen through COVID, as volume comes down, fee-for-service has, just perverse incentives, and the behavior of many systems, right, and providers is not aligned with the needs of seniors. We have to think about paying for outcomes, and I think there's opportunities over the next year or two to do that.
Great. And Howard?
Yeah, I agree. And I do want to point out that there will be opportunities next year as well. There's a sense of urgency among Democrats because many pundits think that the House is going to flip in the next election. If you look at historic trends and retirements and, a host of other factors. So I would anticipate, particularly since the midterm elections are such a focus of concentration for both parties, they understand that older adults vote disproportionately, particularly in non-presidential election years. So that's a big motivating factor. And frankly, we do take advantage of that. So things that are not accomplished this year that are left over from next year, we are going to be pushing. And there certainly will be a lot of things that we're not going to get included this year that may spill into next year. Longer term, I think there are some significant opportunities in the Center for Medicare and Medicaid Innovation. They have a new director that used to work for the Commonwealth Fund, who I think is very smart and progressive. And longer term, there are so many different gaps. I mean, we could spend at least an hour in terms of the need to do more on long-term care so that people don't have to exhaust their life savings since Medicare doesn't cover it very well. Hopefully we'll get into a debate about Social Security and SSI, retirement security. I think a lot can be done on older workers. And the issue for us is really taking a better look at social determinants of health, which the Aging Network has been providing for decades, but really isn't getting sustainable funding, and showing how, we can improve outcomes, we can reduce healthcare costs. We're looking to a new research, demonstration, and evaluation authority in the Older Americans Act, and I think reauthorization in the White House conference will include those kinds of things. So there are lots of opportunities, but lots of challenges that we're going to be facing.
Kristen, just real quick on that last point on social determinants, I couldn't emphasize. I mean, that just needs to be emphasized. Period. Right. I mean, outcomes maybe 20% medical side, 80% the other determinants, and I think this is a great example of, while there might be a little bit of additional funding needed, it really is more about redistribution of the dollars that we spend. And there, as we look, as Howard said, the next year or two or three, and specifically with the Medicare Innovation Group, which Liz Fowler, I agree, is just a fabulous new leader there. There's great opportunity to look about, basically decluttering, these risk-based models, right? And, redistributing dollars so that we are incentivizing, the providers to think beyond the medical lens and really think about the broader determinants that impact, the outcome and the well-being of seniors. And I think if we do that, the overall sort of, health and cost, associated with, those over 65, will be substantially improved.
Yeah, and so what I think you both have really highlighted here is it takes a collaboration, a collaborative effort, a strategic approach to how we get all of the voices and all of the right parties around the table to make real change happen. And so I'd like to shift us now to sort of some practical thoughts on how we get from here to there together. So Tim, I'm gonna shift the question to you after just a little bit of narrative. So as you know, and we've been discussing here about, there's a lot about what the Biden administration and current Congress could do to improve the lives of older adults. However, all too often, older adults do not get the attention they deserve legislatively. For instance, the Congress last year alone only put about 3% of all bills introduced were solely dedicated to aging. And that was during a pandemic where they were the most hard hit in so many ways, that they had extreme challenges. And we've heard about those challenges all firsthand, just from the community organizations on the front lines. And so from our standpoints, I think if now is not the time to maximize the moment and shine light, both on the inequities, but also some of the issues you raised in terms of how we can incentivize differently and so on and so forth, particularly to help the most vulnerable older adults. So my question for you, and I think would be really helpful for our audience and colleagues today, is from your perspective, engaging in policy research and also in philanthropy in your various roles, how could grant makers become more involved and help drive the national aging conversation forward? And what tactics, whether sort of on the more community-based level or through your national lens, have you witnessed to be most successful? So I'll just kick that off to you.
Great question, Kristen. So I think the most important sort of recommendation here is to engage on the issue. And if there was one thing to do, right, it's to ensure that you're informed and that when you engage, that the intent is to ensure that your grantees and the community is as informed on the issue. And when I mean informed, it's not just through the aging lens, right? Ultimately we change policy by having the right people in place, right? That have sort of aligned views on where we need to go, and you get there by voting for, and getting elected, those that, are willing and able to do that. And I think that the mistake too commonly made as we engage around aging issues is viewing the senior voter as this age cohort that votes along the lines of aging issues, and certainly, as I think about, sort of, my parents and other seniors that we interact with, there's, age is a thing, and there are issues that co-travel with age. There's opportunities that co-travel with age, but it's certainly not the only thing that people vote upon, right? There's the sort of, financial aspect of things. There's, sort of, broader, issues related to national defense and infrastructure and all of these other aspects. And I think when you look at the senior voter, it can often appear as if they're voting against their own self-interest if you only look through the lens of, sort of age, right, and things that co-travel with age. But it's really not surprising if you take a step back, because, a senior, yes, is over 65, but they have all of these other things that they care about that relate to their own, sort of prosperity, or their prosperity of their children or their grandchildren, right? And when, the good news here is the opportunity exists to link, these issues that we're talking about in terms of prescription drugs, in terms of social determinants, in terms of moving away from value-based care, not just with what it means in terms of the aging experience and opportunities there, but these are issues of national security. They're issues of financial solvency for our country. And I think the philanthropy can play a wonderful role here in, if they're informed on making that connection of the aging policy and what it means, not only through the lens of an age cohort of a senior voter, but through sort of the broader, the broader or other lenses, that someone might, sort of consider or look at a candidate through.
Great, thank you. And I know we have some other thoughts here that we sort of came up with as a group in terms of other ways to engage grant makers. Is there anything more in terms of sort of how we co-mobilize around issues together, just to kind of springboard off of what you just talked about? There's becoming informed, and how can we be helpful to one another about getting those issues out there to communities, or communities back to the federal level to inform that. And, other thoughts both for you and Howard in terms of how we engage on kind of an advocacy front once that understanding and that educational foundation could be set. I think, and the other part of my question is, there are so many great tools and resources through grants that have been given to folks, including ourselves, to really do innovation in the field and share the tools and knowledge and figure out ways to scale impact together for older adults. So sort of two questions for both of you, but in terms of how we kind of galvanize around issues, but also how we use the good knowledge learned through grants to help one another in that conversation. So Tim, did you want to kick it? And then Howard, you can take it from.
Sure, great. So, obviously engagement goes far beyond education. And here I'll focus on, two areas. One, sort of generating the evidence that would, support some of the sort of the broader policy changes or incentives, and two, just generating, some of the roadmaps, right, that provide sort of tools, resources for other sort of community-based organizations that can do things they just might not know how, right? So the John A. Hartford Foundation, was a sponsor of this webinar, and I think really there's an example here that exemplifies the role of philanthropy. For well over a decade, the John A. Hartford Foundation has funded work around geriatric emergency medicine, very early work, right, to even sort of prove it out from a concept. If you think about like almost no traction and sort of no momentum and no evidence, they built that from a 0-0 standpoint. We, the Gary Mary West Foundation, West Health, and others have partnered with the John A. Hartford Foundation to take that evidence and really codify it into what is now an accreditation process, which there's now well over 200 geriatric emergency departments that are accredited across the country. There's discussion of making that a condition of Medicare participation or tying some of the graduate education funding to those types of practices that would need to be resident within, an emergency department. And what we saw through COVID is that health systems needed to very quickly sort of, change from a center-based model, a brick and mortar, right, to projecting care in the community. And Medicare made adjustments and issued waivers to allow providers to do just that, to think about how can I care for people in their home, in the community, rather than admitting it. And, much of the foundational work that allowed groups to be able to do that, came out of, sort of the years of work around geriatric emergency medicine, because, if there's one thing that's core to caring for, a senior that goes into the emergency department is get them home if you can at all possible, rather than admitting them to the hospital. So I think that's a great example of, on a broader national scale, how you can engage. And then on a local level, sometimes it's just, funding organizations, in a way that allow them to not only do things that are innovative, but to document along the way, to build the blueprint, to build the manual, and then give it away. Right, give it away as often as you can, because I think often, organizations want to do the right thing. They might be resourced to do the right thing. They're just not aware of, sort of the more efficient frontier on how to do it. Right. So I think, generating sort of, the early insight and then driving scale. Philanthropy can play a real role there nationally, and then in small, in a smaller, more community setting, include in your grant making the sort of the requirement, not even a commitment to, but the requirement that we write down what we're doing and we share it.
Absolutely, I couldn't agree with you more. Howard, one quick minute, and then I would love to turn it over to Lindsay. I know there's probably a ton of questions for us, so
sure.
Anything to add?
Just quickly, one thing I've learned over the years is that we're much stronger when we work together. And that's true not only among, aging organizations, but collaborating with people with disabilities and working hand in hand with philanthropies. We've gotten funding in the past from, for example, the SCAN Foundation to form a Disability and Aging collaborative, which is still in existence. There's an Elder Care Workforce Alliance whose work right now is particularly relevant, that was grant funded. I also think that a piece that was written by Alliance for Justice entitled The Philanthropy Advocacy Playbook, if folks haven't had a chance to look at it, it's got some great ideas in there. One of their recommendations is that foundations, to Tim's point, should collaborate with each other to increase and coordinate available resources and ideas. Other recommendations they talk about with regard to advocacy and philanthropy is providing multi-year funding because accomplishing goals in the advocacy arena can require several years of work. Providing general operating support to give grantees the ability to adjust their advocacy work in changing circumstances. And finally, a big piece of this, because we're fighting against very well-organized, well-funded groups who are oftentimes on the other side, is really capacity building, both for community-based organizations, but for national groups as well, building grassroots and grasstops networks, investing in communications for education campaigns. That's really critical if we're going to get these proposals over the finish line.
Great, and we'll be sure we provide the resource to share that you just referenced. So to both of you, thank you so much. Lindsay, I'm going to turn it back to you to see if we have any Q&A that you would like to have right now. Thank you.
Thank you. That was a really interesting conversation. There's so much there. We do have a lot of questions from the audience. So let's start with the American Jobs Act. How do you see that having the potential to change the way that care is delivered at home to older people as they prefer, both in the short term and in the long term? And related to that, recognizing that to avail oneself of home and community-based services, one must have a suitable, affordable, accessible home environment. How does housing policy intersect here?
Start there?
Go ahead, Tim. You want to take it?
No, I was going to say you're probably best equipped to start.
Well, the degree to which this can provide really transformational reforms is a really great question. $400 billion sounds like an awful lot of money, but, right now they're working on drafting legislation, and it looks like it's going to primarily be increasing, again, the federal matching rate. But I think there are a lot of other things in addition to that we hope they're considering that could transform how care is delivered. And there are a lot of pressures to use the funds elsewhere. We are looking at maybe there are Medicare home health changes, maybe there are things that should be done for aides and nursing facilities. But to the point about housing, it's a great point. One of the programs that we've been promoting and hoping to make permanent is the Money Follows the Person program, which was extended in the Affordable Care Act. They keep punting it down the road. But that program really highlights that if folks are going to be discharged from institutional settings, they need a home environment to go to. And there's a real shortage there, and Medicaid doesn't pay for housing. So we've been racking our brains to try to figure out how to get around some of those limitations. And there's absolutely a very strong linkage between being able to get the care at home and having housing available. And, I think the Section 202 program is a particular important program to be investing in that regard.
The only thing, Lindsay, Kristen and Lindsay, that I'd add on top of Howard's remarks are what we've seen with COVID is that we need to keep seniors out of an institutional setting if at all possible. I mean, we've known they prefer not to be there, but I mean, this really has shined a light on just how dangerous it can be to be in a sort of long-term facility if you don't absolutely have to be there. And that's only possible if we have caregivers, whether they're paid caregivers or informal caregivers at home. And the problem has only been getting worse. When you look at the caregiver ratio, the number of available caregivers to those in need of caregiving, it's been shrinking for well over a decade now. And so I think this is a good step forward. I think with additional availability of caregiving models like primary care first that can go at risk for more comprehensive needs of sicker patients, or individuals, have greater chance of getting traction. There's models like the Program for All-Inclusive Care for the Elderly that can provide more formal channels for caregiving. I think that more immediate action to engage on is how we'll define a caregiver, and that ultimately is going to be something that's front and center as Congress sort of debates these policies over the summer and into the fall.
And actually, that speaks to one of our other questions, which is around the role of neighbors helping neighbors throughout this pandemic. We saw it particularly with a lot of the village models where, people were really mobilized to help meet each other's needs while we were all isolating. Is there any discussion about the role of volunteers and that sort of informal kind of service that a lot of us rely on, something like a community care corps, or just something that would kind of formalize volunteers helping one another?
Lindsay, great question. And we might be at, I think, a tipping point or a crossroads on this, because what really is an opportunity is much more intergenerational interaction, right? As we age. And when we, certainly we can look at senior communities and neighbors helping neighbors, but I think the ability of, most seniors to live in a senior community is limited, right? So, you find yourself in the community that you're in, and then the question is, can we leverage the broader community in a very intergenerational way to provide, a more holistic and successful aging process? And that, I don't think, happens through policy. You can incentivize it a little bit, from, sort of back to the bumper bowling example, but it's a real, I think, cultural and value change that's needed. And, it is possible, I think, that with this shared experience of COVID-19 that we've experienced as a country, that perhaps, now is the time to, sort of re-engage on this discussion in a very different way, and perhaps hearts and minds are in a different place than they may have been, in the past. I think, there's many different types of people, but you can boil it down to two things. Those that will sort of do what's best for others, even if it's a mild inconvenience, and then there's, those that hate anything that's even, even slight inconvenience to themselves. And I think we might have seen a pendulum shift there a little bit, and the sort of, the mind and the heart might be more open to thinking about, how we can sort of, care for each other. And I don't think it's just good for seniors. I think if we see more intergenerational sort of interaction, that, sort of the outcome, is really quite rewarding for all involved.
And I agree, and I think it's a resource that is largely untapped. We did do some surveys over the last year that found that volunteers dried up. It was a real problem for a lot of community-based organizations. So it's a real challenge going forward. But I have a lot of friends who are retiring and want to give back to their communities. A lot of us baby boomers are going to be leaving the workforce, and they're looking for opportunities to help out. There is a program, the Corporation for National Community Service, Senior Corps programs. There's senior companion programs, retired senior volunteer programs, but we need to break out of that box and put this on steroids. There's a great opportunity for intergenerational, exchanges. Grandparents caring for their grandchildren is also a related issue, but there's a lot that needs to be done in that space.
And I'll just add, Lindsay, real quickly, without beating this, but I agree with the guys on this one. It's, as a former school board member and also, been in the aging field my entire career, we've seen just with the virtual learning alone, a prime example of how older adults have engaged to help kids with virtual learning during this hard time as well. And to Howard's point, they're willing and wanting to get out there and find that purpose. And are these programs, can they be reformed in some way to offer the stipends to help them maintain some kind of economic security in the process? So I'll stop there.
Thank you. So my last question is about age-friendly communities, because GIA and the philanthropic sector, I apologize for my loud dog, have invested heavily in the age-friendly communities model over the last 10 years. We've seen it proliferate dramatically in communities large and small. And age-friendly communities language was included in the reauthorization of the Older Americans Act. There was no appropriation. Is there an opportunity for philanthropy to mobilize around this issue, given that we have invested a lot of dollars in this space, and communities that are good for older people are generally good for people of all ages?
I think it's a collaborative a collaborative opportunity with the Administration for Community Living. You know, we've seen that on some of the business acumen work that's been done. And, you know, it's important that people need to understand in the Act that authorization does not imply appropriations. There's so many things in the Older Americans Act that are unfunded. So we really need to pull together, again, as a community and recognize that there are partnership opportunities to provide some targeted funding for these kinds of programs, which can really make a difference.
I agree. I think we need a roadmap, right? We just witnessed in California and previously in other states where these plans, these master plans for aging, with real benchmarks and metrics, have been put in place. And largely that's been driven by community-based organizations and philanthropy, not just in California but across the country. So as I look forward to how you get to more age-friendly communities, I start with, like, where's a date certain in some event that you can leverage, right? And so, you think about, this administration, the White House Conference on Aging, will be next due, towards the end of President Biden's term. Is there an opportunity to look what happened in California, what is happening in California and other states, and unite as a group to really put pressure on and define what a broader sort of national plan on aging would be? And when I think about an age-friendly community, it's so multifaceted. Without a coordinated plan, right? You ultimately don't, you don't have a very sort of viable chance of succeeding. But with a plan, it could be transformational, not just for seniors, but as Howard said, what's good for seniors is often good for the rest of us as well.
Well, we're getting to the end of our hour, so I want to close by asking our panelists for their final words of wisdom. Just really quick, one key takeaway that you'd like our audience to remember. Oh, I'll start with Howard.
I'm just going to repeat what I said before. I'm a huge believer in coalitions and collaboration, and we're stronger together. We need to, reach out beyond the aging network, work with health systems, work with the disability community, philanthropy, nonprofits, corporations. We have a huge challenge given our demographic issues that we're going to be facing. And I think there's real opportunities there for us to work together and make a real difference in improving people's lives, particularly people of color who are really particularly struggling these days.
Thank you. Tim.
Sorry, I was having trouble with the mute button there. I agree with Howard. Like, we're stronger together. We need to engage. So I guess I'll just, I'll speak to those that, may have been reluctant to engage on these issues because there's this concern of, well, it's politics and voting and lobbying and we're nonprofit and we just can't do that. And I mean, it is true that there's that you have to navigate things carefully, but it is not true that you can't engage. And that you certainly, if you stick to the issues, you can engage quite effectively and have a significant impact on moving the needle. So I think we need to work together. We need to engage right around sort of evolving these models, but we need to engage on the issues and engage in a very deliberate way that ultimately impacts who represents us and what they stand for. And you can do that regardless of your tax status, if you sort of get good guidance and navigate the waters carefully.
Thank you. And Kristen.
Totally agree with everything that's been said. I would just say 3 key levers for change: data, insights from the field, and also through good policy analysis. Innovations, start small, pilot things for scale, and that starts with community organizations who are on the ground. And lastly, the larger systems change, policy and advocacy, and a collective call to action. Those are things we can all work on together.
Thank you so much, and we would love to work together with you on those things. I want to thank our panelists today, as well as the National Council on Aging for their partnership on today's webinar, and the John A. Hartford Foundation for their support. We will be making today's presentation available to anyone who wishes to view it later, including the slides and the audio. So watch for an email to be sent within a few days. Please follow us on Twitter, Facebook, and our new LinkedIn page, and please complete the brief survey that will appear on your screen momentarily to help us improve our programming. And finally, thank you all for participating in today's webinar. Please be well.